Well, we're going to go ahead and get started. I want to welcome everyone here, and we have Dr. Hall. Dr. Hall is a family practice physician, and he is currently affiliated with Henry Ford Health Systems, and he's also a part of the medical marijuana clinic here in Jackson. And one of the things in my research and looking into whether I wanted to get involved with medical marijuana after I had voted for it, and I found out that it was there. I was not an advocate before, and I started looking into it, and Alzheimer's popped up. And so I was looking through the different conditions, and it just so impressed me as to how well cannabis can work for patients, and inspired me to start the club. One of the main reasons. And I don't have the credibility, that's for sure, Dr. Hall, or the knowledge of how it works and why it works. So I'm going to turn it over to Dr. Hall, and he will be discussing that, and I think he'll be more than happy to take any questions about medical marijuana with other conditions as well, if anyone has them. And so with that, Dr. Hall.
Thank you. Oh, you can clap after, and only if you like it. All right. So I'm Dr. Hall. I'm board-certified family practice, probably 12 years, mostly out of Henry Ford Hospital, but I've done pretty much about every form of medicine you can do. I've worked urgent care, I've done indigent care, I've done rural medicine, I've done prison medicine, and I've worked about 2 years in a nursing home. So as Indiana Jones says in Last Crusade, it's not the age, it's the mileage. So I want to talk a little bit briefly about Alzheimer's. Alzheimer's is a form of dementia. Dementia is not a disease itself. Dementia is simply a constellation of symptoms of memory loss that impedes thinking, calculation, and memory itself, but it's not a diagnosis. Alzheimer's disease is a disease, and it's the most common form of dementia. In America and probably worldwide, it's definitely the most common cause of dementia over 60, the most common cause over 40. Incidentally, the most common cause under 40 is AIDS multi-infarct dementia. Alzheimer's disease has two identifiable properties, two forms of nerve damage. You have these little fibers that form on the nerve endings called neurofibrillary tangles, and you also have deposits in the brain called amyloid deposits. Why is that important? Well, when you have that damage to the brain, you start to lose a really important neurotransmitter in the brain called acetylcholinase. And acetylcholine has important functions in memory, learning, and calculations. So that's believed to be where the problem is. Although Alzheimer's disease has a genetic component, it is not in and of itself a genetic disease. No one really knows why it happens. There's lots of theories. And even if you test positive for these new markers for Alzheimer's disease, that doesn't mean you'll get the disease. That just means your lifelong risk is increased. We'll talk a little bit more about that later. So, symptoms of Alzheimer's disease. People always say, how do I know if I have Alzheimer's disease or my family member has Alzheimer's disease? And it's not just aging. Everyone tends to forget things as they get older. Some people younger than others. But if you look in your handouts, you'll see some really key factors that can trigger and indicate that you may be at risk for Alzheimer's. One of the first ones that family members will tell you, and your family or your family members or your significant other, they're the ones that will come in and tell the doctor that there's problems, not the patient. The patient never has a problem. But the biggest one that people will say first and foremost is, my mother or father is driving me crazy. They tell the same story over and over and over again, and if you don't help them, I'm going to kill them. That's the first one, and that's pretty mild. Then it starts to progress. It becomes less from annoying, then it becomes more dangerous. Now they're not just telling the same story, but they're leaving the stove on when they cook something, and then part of the kitchen catches on fire. Or they went out to the store to get something, or they went out to their car and they got lost. And that's when it becomes personal danger to the patient itself. And those are some of the big ones. There's a few others on here that I set out. getting lost in familiar surroundings, and then it progresses to actually daily non-care of self, not washing, not bathing, not changing clothes for days on end, not doing any chores around the house, not doing the dishes, and then it becomes a health hazard. And that's when Alzheimer's tends to progress from mild to a more severe case, and the patients may not be able to take care of themselves or even live independently. As far as treatment of Alzheimer's goes, there's only a few approved medicines out there. One of the big classes is called acetylcholinesterase inhibitors. I said acetylcholine is the brain transmitter that depletes in the brain and causes some of the memory loss. Acetylcholinesterase is a protein in the brain that actually breaks down the protein, so it actually results in more of a loss of acetylcholine. So if you can block that chemical, you can increase the amount of acetylcholine in your brain and hopefully slow down some of the symptoms of Alzheimer's. And there's 3 drugs in that category. The most common one that everyone knows is Aricept. All right? Everyone seen it on TV? Yeah. Okay. Aricept's not a bad drug. Not going to knock it. It's helped a lot of people. None of these drugs out there, though, slow the disease itself. You're simply slowing the symptoms to allow people to live independently. So we still do not have any real treatment to stop the progression of the disease. And Aricept has its own problems. Aricept has several side effects, like all drugs. Most commonly being nausea, vomiting, weight loss, headaches, dizziness. And then the next drug works on a different neurochemical. It's called Namenda, and that mainly affects glutamate, not acetylcholine. Not that that matters, it's just a different brain chemical. Not a bad drug either, but only indicated for severe Alzheimer's when stuff like Aricept's not working, and it also has a lot of side effects. Dizziness, confusion, headache, constipation, nausea, agitation. Some of the things we're trying to stop. And then there's a whole bunch of miscellaneous drugs. You'll hear web is flooded with misinformation. Supplements, calcium, vitamin E, zinc, antioxidants. None of this stuff has been proven to work. Some of it may be dangerous. High-dose vitamin E has now been dangerous and proven to cause increased death in certain populations. High-dose calcium in the absence of vitamin D can cause death in certain populations. Coenzyme Q can cause death in certain cardiac populations. So you really have to be careful what you read on the web as far as alternative therapies for any disease, especially Alzheimer's. Now, medical marijuana and Alzheimer's. Medical marijuana, for most of you may or may not know, has 2 active components or 2 active ingredients. You have THC, and you also have a group of components called cannabinoids, mainly CBD1 and CBD2. Both of these are active ingredients of medical marijuana, and both of them work on many symptoms of many diseases. The big things we're trying to treat in Alzheimer's are agitation, anxiety, which is some of the symptoms that tend to cause people to have falls and danger to themselves. And the other big problem when you have late outset Alzheimer's is decreased appetite and failure to thrive, which basically people are not eating and not eating enough, and they're progressively losing weight. Now there's a lot of research, but it's fairly small, and I'll get into why that's important. Cannabinoids themselves have been studied, and they induce neuroprotection against certain damaging effects of Alzheimer's. All that means is it seems to protect against cell damage of the brain. And THC itself, let me go to my notes here, results in, and I want to get this quite specific because these journals get highly technical, results as reduced nocturnal motor activity, agitation in severely demented patients. What does that mean? They don't get up and they sleep better. That's all that means. But there's some problems with the studies. When you're in medicine, we really count on what's called randomized double-blind trials. That means you take a large group of people, you give half of them one medicine, and you used to give half of them placebo, but now placebo is not good enough. You have to give one group one medicine, and the other group a medicine that's already been proven to work. So the problem with some of these studies are 3 things. They're too small, because marijuana research is highly controversial and poorly funded. A lot of times they don't go for long enough. Usually most studies will need to go for 6 months to counteract what's called the placebo effect, which is actually a good effect. It should not be ever negated. The placebo effect is one of the most powerful things in medicine. But most studies have to go 6 months long to say that it's not a placebo effect. And the studies, what's the other thing? No, those are two of the big ones. So we have to take these studies with a grain of salt. There seem to be some positive effects for agitation, and there seem to be some positive effects for sleep, and there seem to be some positive effects for weight gain and increased appetite. That said, can we openly endorse this? And I have to pose a couple of questions with that. Since the studies are not the greatest and don't have enough people, we have to take it with a grain of salt. But I will say this. When you are elderly and have Alzheimer's, you more than likely have multiple other medical problems going on. And once you're on 5 medicines, your risk of drug-drug interactions is 50%. Once you're on 8 medicines, your risk for drug-drug interactions is 80 to 100%. And I don't know many elderly people with multiple medical problems that are on less than 8 medicines. So that makes medical marijuana a good potential choice for some of the Alzheimer's symptoms, the agitation symptoms, and for appetite. There's really only 2 drugs in the medical community for appetite. One is Periactin. It is a stimulant, and it has to be taken 3 times a day to do any good. The other one is Megace, which is a hormone-based medicine, and it has a lot of side effects as well, including blood clots, which doesn't do you well for someone that may be bedbound or doesn't have a lot of activity. So medical marijuana is a good choice in that aspect. Medical marijuana also has the added benefit that it can be used 3 ways. It can be smoked, it can be orally ingested, it has some benefit topical ingested, and it has oral food forms and oral liquid forms, which is good when you have elderly folks that may have swallowing difficulties, can't stand swallowing pills. One of the biggest complaints we always got in the nursing home was people were nauseated all the time. Why? Because they didn't eat much and they were taking 10, 12 pills a day. So this is a good alternative for that as well. I think the data will start to come more and more frequently, and I think more and more studies will be done. We do have to tread cautiously, but I think it's an excellent alternative for people that are already taking a lot of medicine, have problems taking a lot of medicine, and have a lot of agitation and have very limited resources. And that's all I have today. I wanted to keep it short and sweet and to the point and open it for questions. All right, I'd like to thank you all for coming. I'd like to thank you for sponsoring.
Thank you for coming. Yeah, we appreciate that very much.
No problem. I'm Dr. Jamie Hall. Thanks for coming, and thanks to the Medical Marijuana Clinic of Jackson.